Virtual reality can make healthcare more pleasant. The proper virtual reality immersive experience will be an golden gift for those who are suffering from the pain.
My name is Jaiyramanan Vijayalaayn, and I'm excited to present my final year project, an innovative approach to a DQN-based personalized pediatric pain management model with tactile feedback in virtual reality exposure therapy. An innovative approach to the pediatric pain management with virtual reality under the guidance and supervision of Professor Prasad Vinvarat. A research in 2022 by D. Silva highlights that in Sri Lanka, over 70% of pediatric patients report a moderate to severe pain during routine medical procedures such as venipuncture, which is also known as blood draws. A research in 2024 highlights that traditional pain management options such as opioids, which is called as painkillers, can be an effective but come with side effects, including sedation, respiratory depression, and potential dependency over prolonged use. Given these drawbacks, there is a critical need for effective non pharmacological alternatives. There have been numerous studies going on the VR's efficacy in reducing pain perception during various medical procedures, including wound care, dental procedure, and physical therapy. The mechanism of the VR therapy is VR works by immersing the patient in engaging virtual environment by diverting their attention from the pain sensation. For example, in the image, a pediatric patient, a pediatric burn patient uses VR to distract during their surgical pains to divert the attention from the pain sensation and activating the sensory pathways that inhibit pain signals. The researcher Hoffman have been done several researches from 2000 to currently 2003. There have been several researches have been done by Hoffman in burn patients, even in spinal injury also. Also, Erin Marchi had gave birth to her second child with the help of VR for easing the pain. The mother said she was so immersed in the VR experience that she couldn't feel the pain much. Okay, so now a question arises. So, what makes a meaningful reduction in pain through VR? As for that, another research answers for that question. As pain threshold is an individual and subjective issue, the VR usage during medical procedures should be personalized for meaningful reduction. The literature review has highlighted the several limitations in the current VR system. The current VR system solely relies on one fits for all approach, and the limited immersion and limited personalization and limited interactivity and limited adaptation according to the pain levels. Many VR solutions offer a preset and experiences that cannot adapt to the dynamic nature of the child's pain experience during the procedure. A static VR environment offer a limited opportunities for interaction, reducing patient engagement and potentially hindering the distraction effort. The limited personalization. Current VR pain management solutions often lack personalization. Experiences are not tailored to the specific needs, preferences, and pain conditions of the individual patients. A 2024 research highlighted. A 2020 research highlighted
Relying solely on the visual and auditory stimuli limits the feeling of being in the virtual environments. So, several researchers have been highlight that the limitations currently on the VR system. There is a significant gap in VR pain management studies suggesting future research should focus on improving physical interactivity, personalization, and real time adaptivity are crucial for optimal VR interventions. So, I came to this idea when I was in 2022. The research requirements I identified through initial trials. I did a initial trial in City Central Hospital, which was a small clinical trial which was conducted with a cystoscopy patient. Cystoscopy is like endoscopy. There will be a camera tube will be inserted. That camera tube is inserted through urethra. It's a very painful procedure. The initial trial was conducted on February 22nd, 2023, under the guidance of Dr. Uma Shankar. Under the doctor's supervision, we integrated our VR therapy during the cystoscopy procedure. The patient underwent the snow world therapy.
சுமாராக அது போட்டத்தில் கொஞ்சம் மைண்ட் கொஞ்சம் நார்மல் ஆகிடுச்சு இருந்தாலும்